My name is Brandon Lane. I'm a student physical therapist assistant at South University. Today we're going to be looking at a patient. He's a 41-year-old male who suffered a left MCA from a complete occlusion of the left cerebral artery. Currently, he lives with his wife and 3 kids. He lives in a rented house that's only 1 story, but he has 2 steps to go into before getting in the house. So obviously we'll be taking into account that as we discuss his treatment today. As I said, he does have a left-sided stroke, so we get all the classic signs of everything he had today, such as affecting the right side. He has hemiparesis. As well, he also has increased spasticity of the right lower and upper extremities, ranked number 2 on a modified Osler scale. As far as cognition, he's disoriented to time. He has an attention span of 30 to 45 minutes. He is a little bit difficult to examine because since he's on the left side, that's why all your language comprehension happens. So we have a little bit of language comprehension issues. So there are some deficits that we need to be aware of. He has difficulty following directions for motor responses, so we're going to try to keep the commands to about 2 to 3 steps. But the good news is that he's very motivated. He's cooperative. He definitely wants to do this program, so that's a plus. As far as range of motion, left side upper extremities all within normal limits. The right upper extremities within normal limits, but we have flexor pattern, so we're going to see this motion a lot. And he also has pain if the right shoulder is moved towards the end range. As far as the right lower extremity, it's an extension pattern, but the key thing is his dorsiflexion. His dorsiflexion is lacking. He only has 0 to 5 degrees of dorsiflexion. He's also missing sensation on the dorsum of his foot, so the area right here. And speaking of which, he's also the right hand. We need to be aware that he has no voluntary use of his right hand, and he also has right neglect. So he's very likely to leave his right arm hanging. So we gotta make sure that during the treatment, we make sure that his right arm is tucked away in a gait belt, or else I have control of the right upper extremity. Coordination, he's intact, but is unable to touch the right for obvious reasons. Sensation, we discussed that. Proprioception is difficult to assess without pain in both the right and lower upper extremity. Postural, he has good head posture. His static sitting's good. He could sit by himself up to 5 minutes. Sitting dynamic control is spare. We have reduced shifts to the right side, of course. His standing static control is spare. He can independently stand in parallel bars for 1 minute. And yes, we have an AFO that's being ordered to take care of his right dorsiflexion. But unfortunately, his standing dynamics is pretty poor, so we're going to try our best to handle that today. Functional mobility, he rolls to the right independently with a bed rail. To the roll to the left, he needs minimal assistance because he's unable to use his right side as well. And supine to sit, assisted supine involve both minimal assist, will sit to stand a moderate assist. And as far as ambulation, he can ambulate 10 feet within the parallel bars with max assist. So because of all of that, he's been a computer programmer for the past 20 years, so it's not the most lively of occupations, so we just want to make sure he can just stand up or get out and about. So we chose short-term goals for wheelchair to mat transfers with constant guard assist and verbal cues and or tactile cues for sequencing. Another short-term goal is to go from supine to sit with constant guard assist. And for our long-term goal, we're going to ascend and descend 2 steps, 1 at a time with 1 foot with single railing supervision, because that's what he needs to do to get into his house. Physical therapy is going to be a great idea because we need to find a way to reduce the spasticity in his right side. So I'm hoping that with proper weight bearing, the spasticity is going to drop, and then we'll have proper range of motion of both the right arm and the right leg. That being said, let's go look at our patient. Hello, how are you doing today?
Hello.
My name is Brandon. I'm the student physical therapist assistant who'll be working with you today.
Okay.
May I have your name and date of birth, please?
Tamika Witcher, 09/11/1989.
Excellent. So first, we're just going to start with some manual muscle testing today, just to see if you're getting all nice and strong for us. I'm going to move the footrest. Is that okay?
Okay.
Yeah, just make sure. Just let me know if there's any discomfort or anything. First. All right. Can you bring your toes up to the sky? And relax. All right, this I'm going to get you to do the same thing, but I'm going to ask you to hold so I can apply some pressure just to make sure you can resist.
Okay.
All right, go ahead, do that. Hold, 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 good. Now, gently do it with this leg. I know this leg has been a little bit affected recently, so just let me know if there's any pain or anything. Come on, there we go.
would like for you to bring your toes as high as you can. Just don't worry about it being complete. Just do the best you can. All right, good. Relax. All right, same thing. Just bring those high as you can and just hold, 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 hold. Good. All right, so both of those are 5 out of 5. I know that this doesn't have the range of motion we want, but within the range of motion, it's still a 5 out of 5. So that's good. Okay, so now we're just going to do some sensation testing. I'm going to use this to test your sensation. Do you feel that?
Mm-hmm.
Yeah, we're going to do that on your lower legs. I just would like for you to close your eyes, and I'm going to be watching your facial expression just in case, but if you do feel something, feel free to say you feel it if you do it, okay?
Okay.
Excellent. So close your eyes, please.
I feel something. Feel something. Feel something. Feel something. Feel something. Feel something. Feel something.
Okay, you can open your eyes now. So far so good. We are missing a little bit of sensation on the top part of your right foot right here. So that's normal in situations like these. So we're just gonna make sure we do our best to take that into consideration.
Okay.
Just make sure you constantly watch your right foot to make sure that it's not hurt or bruised or anything. Okay.
Okay.
Excellent. And next we're gonna use. Speaking of range of motion, we're going to do the range of motion test right now. Just make sure that we're getting the degrees we want. So you take your shoe off, is that okay?
Mm-hmm.
This is a little bit as we can. Now this right here. There's your ankle. All right, bring your toes up as high as you can, please. Alright, you can relax. Alright, so we got about 17 degrees on that foot. Alright, now bring this foot up as high as you possibly can. Alright, good. Okay, we can relax. So about 5 degrees on this one. Okay. We need a little bit on progress, but what I'm hoping will work for you today is what's called an ACE wrap band. I'm gonna put your shoes on again for you. Oh, sorry about that. Missed somehow. I think this is gonna work wonders for you. May I, you okay if I apply it to you?
Mm-hmm.
Yep. Hey, how's that feel?
That's pretty good.
Nice. Happy to hear it. All right, so first we're gonna start with some exercises today. But first of all, I just want to know if you know what this is.
Mm-mm.
This is a gait belt. It's gonna help me have better control of you while we're doing the exercises. Is there
Okay.
any surgeries or sharp objects around your stomach that might be harmful, you think? I should lean forward just a little bit. I'm gonna try to keep your right arm over here. I noticed that sometimes you kind of almost want. I don't want to say forget about it, but it leans over a lot. So I just want to make
Okay.
sure that you keep that in mind. That's not too tight, is it?
Mm-mm.
Perfect. Let's do some more. There we go, nice and snug. All right, so next we're just gonna start on some stand-ups. These are gonna help you, they pretty much is just to help you do the motion standing, get used to it. Especially it's gonna help you put weight on this leg. Just to help it relax. Is there a way for you to slowly relax this leg? And there we go. Just try to keep it like this. Now, this time, I would like for you to hold on to my hands as much as possible. I'm gonna ask you to scoot over. So please use your arm to scoot over into my right arm, into my left shoulder, into my right shoulder. Yeah, perfect.
Now I'm gonna ask you to put your nose over your toes. You're just gonna lean forward, and then using your legs, you're gonna kick up, okay? So put your forearms on me. Slowly, just kind of relax. All right. So when I say nose over toes, you're gonna lean over, and then you're gonna use your arm strength to push into my forearms to lift you up. That'll put weight bearing through your arms. And even though I know that you're unable to use this arm, but you should be able to use your forearms to push up.
Okay.
Okay. All right. So 1, 2, 3, nose over toes. Up. Perfect. Now sit down slowly. Yeah, just bend your knees. We're gonna do this 10 more times. Up. And then down. Nose over toes, stand up. Weight bearing through my arms and sit down. There we go, 10 times. We did that 10 times for 2 to 3 sets. How did that feel? Was there any pain anywhere when we did that?
Mm-mm.
All right, perfect. So next we're gonna go ahead to the parallel bars. You can go ahead and scoot back. Since we are gonna go some distance, use your left arm to put you in. I'm gonna help you on this side. Perfect. So just sit back tight, just in case, since there is a bit of a travel, we are gonna put these back on. Leg up, there you go. Perfect. So we're just gonna roll it to this side right here. So I hear that you have 2 sets of stairs to go into before you can get into your house. So I thought this would be a good way for you to practice stepping in a safe environment. Pardon me. Move these again, because you're about to have some fun. Perfect. So we're gonna help you stand you up. I would like you to use the same method we used earlier. So when I stand you up, what we're gonna be doing is practicing step ups, just like this. We're gonna do that 10 times. Once you're gonna do that 10 times, 2 to 3 reps. We're gonna do this until the goal is 10, but hopefully if you get tired, we can do 5. It's up to how well you can handle it.
Okay.
All right. So let's go ahead and put my arms right here. Go ahead, extend this. Put your arm right here. Can you slide up for me right quick? And my right arm to my left shoulder. Use your arm as much as you can. I got this one. All right. So go ahead and put this arm right here. Once again, use your forearm for the most part, even though you can't use your right hand.
Okay.
All right, 1, 2, 3, lean over and push. All right, are you able to step onto the box with your left foot? All right, and then relax. Right foot as much as you can. Good. Keep growing to the parallel bar right quick with your left hand. I'm gonna put this in here, and that'll help you out a lot more. All right, left foot again. All right, right foot again. There you go. One more time for 10. All right, and this one again. Up. Perfect. And you can relax. Back up until you hit the back of the chair with your legs. All right. Now slowly bend your knees backwards. All right. So how you doing so far?
Pretty good.
Okay, great. So now we're going to do. We're going to work on some rotations. This will help you go from one side of the bed to the other. That'll definitely help you get better on traveling independently.
Mm-hmm.
So first, I would like for you to have your arm like this,
Mm-hmm.
as well as hold your arm like this, and both your legs are flexible. So that's good. So pretty much, you're gonna try to bring your right shoulder to that wall, and then bring your left shoulder towards the knee. All right. You think you can do that 10 more times?
Mm-hmm.
All right, let's try it. 1, 2, 3. How you feel?
Pretty good.
Awesome.
and 10. Great. So we did that 10 times, 2 to 3 times reps, and that was pretty good. You went all the way to 10. So next, we're going to actually do our functional activity now. Pretty much, and there's going to be a handful, so just bear with me. We're going to sideline, put yourself on your right side. Then we're going to get into sit. Then we're going to stand. Then we're going to get you in that wheelchair. How's that sound?
Okay.
Excellent, perfect. So next we're going to, first step, we're going to go step by step, one at a time. Our first step is to get you onto your right side. So once again, just hold onto your right elbow and keep this leg just as flexed as you possibly can be. Yep, just like that. And I would like for you to lean into this way. So let's go. You should start it. 1, 2, and all the way. 3. Perfect. Now I'm gonna have your leg like this. This will help you put this will help you put this leg into flexion. On the count of 3, I want you to do 2 things. Push off the mat with this hand and bring this leg as close to your chest as possible. And this will have your leg like this will also help bring this leg up as well.
Okay.
Okay, so 1, 2, 3. Push up and kick forward. Perfect. Now, we've done this before, so let's go ahead and put your arms like that. You're already at the edge. Your leg's good. You can go ahead and grab my forearm with this one, and I'm gonna rest your forearm on this one. Try to use your forearm since you can't use your hand as well, and then you can grab it with this one. 1, 2, 3. Lean forward and up. So far, good so far? All right, great. So you can waddle over here, just dance around. How's your right leg feeling?
It's okay.
Perfect. Just lean back into your back, the legs touch the seat. And now you're gonna slowly bend your knees, slowly, and lean back. Lean all the way back at the back of the chair. Perfect. Now to put your foot down. There we go. There we go. Just want to fix that for you. Let's go ahead and get this one. Perfect. So how do you think today went?
Good.
Awesome. Was there any point where you felt discomfort or nervousness? Okay, I'm happy to hear that. Well, good news is we're done. Bad news is you got homework. So I would like for you to follow this program right here. These are pretty much similar to what you did before. You got knees to chest, laying on your back. You got toe flexion, where you're just laying down, bring your toes to your face. And then you got sitting rotation, where you're pretty much doing the exact same thing that we just did. The reps were exactly the same, 5 to 10, preferably 10. We can start at 5 if you feel like getting tired. And do that 2 to 3 times at once and 2 to 3 times throughout the day.
Okay.
All right, and that'll be pretty much it. I just wanted to end on some clarifications. I noticed throughout the day you seem to have forgotten your right arm was there because oftentimes it was leaning over the wheelchair or it was the last body part I saw moving. I just want to make sure that you always have your right, either you're grabbing your right arm or you put it in your belt or whatever it is that you're wearing at the time.
Okay.
And you also might want to consider getting a sling just in case. And I'm going to tell this to you and your wife and your 3 kids as well, since you're all living in the same house. But I just want to make sure that you use your right arm and your right leg as much as possible. The more weight you put on it, the less tense it's going to be, and you'll be able to use both of those limbs better.
Okay.
Okay, was any of this overwhelming for you? Is there anything I needed to repeat? Or all right, perfect. And I'm going to write all the instructions up. I'm going to give them to you and your wife as well. And we'll be on our way.
Okay.
Excellent. You did very well today.
Thank you.
Yeah, thank you.